So this project used the MEPS database. It's a medical expenditure panel survey to look at a large population to assess for a link between pneumonia and dental care. And the reason that that study was done was because there's very good evidence that oral hygiene is very important for general overall health. It's involved in a lot of different infectious diseases. So as an infectious disease physician, we always look in the mouth. And as a clinician, I've often been frustrated when I do see dental problems in a lot of my patients who don't have dental coverage. I feel a little bit helpless as to what to do for them. So in this study, what we set out to do was to look for a link between actual dental insurance and less pneumonia risk. Because we felt that people who had dental insurance would go to the dentist and would have better oral hygiene, thus preventing pneumonia. We didn't necessarily find that. What we did find is more so than having or not having insurance, being able to routinely go to the dentist was related to a decreased risk for pneumonia. So those people who said that they went to the dentist more frequently had a decreased risk of pneumonia compared to those who don't go. Next steps would be, we would like to confirm this with some additional study looking at specific parts of the population, such as younger groups, and just try to determine how longitudinal this healthy behavior needs to be, and also if there's other healthy behaviors that are maybe accounting for some of this difference as well. We did control for various comorbidities and socioeconomic factors in this study, but we didn't explore, it may be that there's other healthy behaviors that we didn't necessarily control for, like just routine exercise, and it could be that people who go to the dentist with frequency are doing other things in their lives that aren't being captured that are also promote good overall health. The mechanism for this would be based on studies that have been performed previously, and if you think about it, the mouth does have direct communication down into the lungs. It's protected by structures in the airway, of course, but we do know there's an increasing recognition that saliva does in fact track down there on a routine basis, even in normal healthy people. Usually it's not a problem. We can control any kind of bacteria that track down, but it would seem that in people who have either a large burden of bacteria or potentially a large number of pathogenic type of bacteria because they have dental disease, may be at an increased risk because those quantities or those specific bad bacteria are tracking down into the lungs. No, and that is a distinction between previous studies and this one, in that most of the work with oral hygiene and pneumonia has been in higher risk groups, such as the elderly, such as those with who are in nursing homes and maybe have some neurocognitive reasons why swallowing would be a problem. But for us, we used a large population-based survey, and we did control for age in that survey. So even if you take apart age, take apart various comorbidities, there still is a risk that is attributable to dental care. So not as much as I would like. At my institution, certainly we do have a dental school, and that is where I end up sending a lot of my patients who don't have means to get dental care otherwise. But you know, one of the arguments that I would like to make with this paper is that traditionally dental care is very separate from medicine, and you know, as we're discussing kind of how to best treat patients with the limited resources that we have, it would seem reasonable to try to combine the two. So I think from this meeting, there has been a lot of discussion and increasing discussions about, of course, antibiotic stewardship and how we best maintain the antibiotics for future use. And I think preventive care has a part in that if you don't develop problems, you potentially don't need to use antibiotics in the future. I know even as an infectious disease physician, I could probably be more cognizant of the antibiotics that I am using, and that is a goal for me coming back from this conference, to really, even within the realm of infectious disease, even given everything I know about antibiotics and resistance, I feel like I could still probably do more to make sure that I'm using everything as judiciously as possible.